All right, today we're diving into a medication that has to perform an incredible balancing act. On one hand, it's a lifesaver, but on the other, it comes with some serious risks. It's called Mycophenolate Mofetil, or MMF for short. Its entire mission, to stop your body from attacking itself. By the end of this, you're going to understand exactly how it pulls off this high-stakes job.
So let's kick things off with a really important question. What happens when your body's own defense force, your immune system, goes rogue? Instead of protecting you, what if it starts attacking a brand new life-saving organ? Or what if it just turns on your own healthy tissues? Well, that internal conflict is exactly the problem Mycophenolate Mofetil was designed to solve.
So, here's how we're going to break it down. First, we'll look at this civil war happening inside the body. Then, we'll introduce MMF as the targeted weapon to deal with it. We'll peek under the hood to see exactly how it works, figure out who needs it, and then tackle the really big part, the high-stakes trade-offs. We'll wrap up with the essential rules for staying safe.
Okay, so this civil war inside your body, it really plays out in two main ways. The first is right after an organ transplant. Your immune system is brilliant, but it can see that new organ as a foreign invader and try to destroy it. The second is with autoimmune diseases, where the whole system just gets confused and starts attacking your own healthy cells. In both cases, your defenders have become the attackers.
And this is where Mycophenolate Mofetil comes onto the scene. You can think of it as a highly specialized peacemaker, a drug that's literally engineered to step in and shut down this internal conflict before it causes a total catastrophe. Now, here's a key detail. MMF is what's called a prodrug. That means it's actually inactive when you take it. It's kind of like a secret agent that has to be activated once it's behind enemy lines. Inside your body, it transforms into its powerful active form called mycophenolic acid, or MPA. And that clever design is absolutely central to how it works. You'll see MMF out in the world in a few different forms. The most common brand name is CellCept, though, of course, there are generics too. It can come as a pill, a liquid you drink, or even an IV if you're in the hospital. You might also hear about a related drug called Myfortic. It's basically the same active ingredient, just with a special coating to help it release a little later, which can sometimes be easier on the stomach. Okay, so how does this thing actually disarm a rampaging immune system? To get that, we have to zoom way in, right down to the cellular level. This is the really cool part. This is where you see just how brilliant and targeted its strategy is. See, this drug isn't a blunt instrument. It doesn't just shut everything down. It has very specific targets, the elite soldiers of your immune system. We're talking about the lymphocytes, mainly the T cells and B cells. These are the guys responsible for leading the charge in any immune attack. Now, for these soldiers to build an army, they need to multiply like crazy. And to do that, they need to make more DNA. That requires a special kind of fuel called purines. And right there, that's their weak spot. See, most cells in your body have two different supply lines for this fuel. One makes it from scratch, and the other recycles old parts. But T cells and B cells, they rely almost entirely on just one of those supply lines, the one that makes it from scratch, called the de novo pathway. And that vulnerability is exactly what MMF exploits. Here's the mission plan. First, you take the drug, and it gets activated into MPA. Then, that MPA hunts down a very specific enzyme, the gatekeeper for that one special fuel line. The MPA blocks that gatekeeper, effectively cutting the fuel supply. And just like that, the T cells and B cells are starved. They can't multiply, they can't build their army, and the attack just grinds to a halt. Mission accomplished. It's pretty brilliant, right? So now that we've seen how it works on the microscopic level, let's zoom back out. Who are the actual patients on the front lines? The people who rely on this powerful medication every single day. The drug really has two primary missions in the real world. The first, and its main approved use, is to prevent organ rejection after a transplant. The second is to get autoimmune diseases under control, calming down that immune system that's turned on itself. So yeah, MMF is an absolute cornerstone for people with new kidneys, hearts, livers, you name it. But its use has also ballooned off-label to treat a whole bunch of autoimmune conditions, things like lupus that affects the kidneys, really severe skin diseases, inflammatory bowel disease, and a lot more. It's become an incredibly versatile tool for doctors. But a weapon this powerful always comes with a trade-off. Deliberately suppressing your immune system is what saves lives, but it also, by definition, creates vulnerabilities. This is the high-stakes part of the whole deal, and it's so important to understand the risks involved.
The potential side effects really fall into a few big categories. Some of the most common are gastrointestinal issues, like diarrhea or nausea. But the more serious ones include a much higher risk of infections, problems with your blood cells, a long-term risk of certain cancers, and a couple of other really specific warnings we absolutely have to talk about. Let's dig into those blood issues for a sec. MMF can lower your white blood cell count, that's called leukopenia, which makes it harder to fight off infections. It can tank your red blood cells, causing anemia, making you feel tired and out of breath, and it can lower your platelets, which can lead to easy bruising or bleeding. This, right here, is why anyone on this drug needs regular blood tests. It's non-negotiable. Okay, now we have to talk about what is, without a doubt, the single most critical warning for this medication. MMF is known to cause severe, devastating birth defects and miscarriages. Let me be crystal clear. This drug is absolutely forbidden if you are pregnant or trying to become pregnant. The risk is not small, it is profound. And the response to that risk has to be just as serious. That's why the official guidance is unequivocal. Women who could potentially become pregnant must use two, not one, but two separate and effective forms of contraception. And this isn't just a suggestion. It's the rule for the entire time you're on the drug, plus for 6 weeks after you stop. That number, 2, tells you everything you need to know about how serious this is. So, with all these risks on the table, managing the mission safely becomes a true partnership between the doctor and the patient. To get the benefits of this drug, you absolutely have to follow a clear set of rules. One of the most common day-to-day challenges is just managing interactions. You wouldn't think it, but simple things like antacids or supplements with iron and calcium can actually grab onto the MMF and stop your body from absorbing it. So the rule is simple. You have to space them out. After you take your MMF dose, you have to wait at least 2 hours before taking any of those other things. And finally, safety really hinges on the patient's role. First, adherence is everything. Missing doses can literally trigger organ rejection. Second, you have to be vigilant. Any sign of infection, a fever, chills, you call your doctor immediately. Third, sun protection is a must to lower that increased risk of skin cancer. And of course, you've got to show up for every single one of those blood tests. It's all part of the deal.
And really, that brings us right to the heart of it. Mycophenolate Mofetil is a remarkable, life-changing drug. But its incredible benefits are constantly being weighed against very significant risks. And that requires careful, diligent, lifelong management. It really leaves you with a big question, doesn't it? As we get smarter, how do we keep refining this balance to design therapies that are even more targeted with even fewer trade-offs?